Welcome to Tech Talks, the People and Planet podcast. On this episode, I'm joined by Eric Sunset, the VP of Marketing and Business Development at healthcare platform DocBuddy. Hi, Eric. How are you?
Hey Lee, thanks for having me. I'm excited to be here.
Thank you for joining us. Really excited for this episode, Eric. I mean, as you know, I'm based in the UK, and we have some very similar problems to you guys over in the US with regards to healthcare workers. So really interested to find out what DocBuddy is all about. So to kick things off, DocBuddy is all about saving time and I guess effort for healthcare workers. Could you kind of expand on that for our listeners? Talk about the problem that you guys are solving with a mission, perhaps inspiration?
Absolutely. So DocBuddy is all about giving time back to our healthcare stakeholders, primarily the provider. So either the surgeon or the physician, their mid-level providers, their staffs, their auxiliary staff that handles the billing and any patient interactions. But just like you across the pond, Lee, our providers are more burned out than they've ever been.
Yeah.
And DocBuddy got its start with the some reporting back in 2016 that providers are spending as much as 2/3 of their time on paperwork or other administrative tasks. And I'm sure you can relate the same way I do. I cannot imagine going through medical school, going through residency, perhaps attaining my fellowship. And the one thing that I want to do is treat patients and provide better health outcomes for people. And instead, I'm now my own secretary. I'm now my own data entry clerk. That is not what they went to school to do.
Not what they signed up for, right?
Not even close, not even close. And we're here in the US, we're coming up against the edge of this cataclysm where because providers are so burned out, they're leaving medicine early. They're retiring before they're expected to. And in the next handful of years, because physicians are so dissatisfied with their jobs, you're going to be waiting a long time to receive even the most basic of primary care. So what do you do about it? Well, you need to address the problem at the root. And it all boils down to workflows. It all boils down to the workflows enforced on providers by sort of the legacy software vendor. Our federal government hasn't helped in this endeavor really whatsoever with the passage of meaningful use. So DocBuddy exists as a way to give providers back more time for life, to keep them out of their laptops, and really to let them go home and have dinner with their families or go to happy hour with their friends.
Yeah, sounds good. And just for the benefit of our listeners that perhaps aren't quite as familiar with the terminology, what workflows? Give us an idea of what that is.
Sure. So we're still talking on this issue where providers are spending 2/3 of their time on administrative tasks. And here in the States, Medicare, which is our federal government's insurance brand, I guess you'd say, or federal insurance carrier, I guess you'd say, there are a number of requirements that you need to meet as a provider to check all of these boxes for data capture. Is this patient a smoker? What's their family history? Do they have any other issues that we need to be checking boxes for? And that ends up putting the provider into this headspace of clicking through windows, clicking through pick lists, selecting. It's a cascade of different choices for them. And at DocBuddy, we know there's a better way. So when we talk about workflow, we want to keep people away from these endless series of windows and pick lists and give them something much more rapid to use.
Understood. Thanks for that. So the product itself, then you guys are an iOS and an Android app. How does it actually work? What's the text that's driving it behind the scenes?
Yeah, you got it. So you hit the nail on the head that for our providers, so for our doctors, for our surgeons, they're using the mobile app, which operates on both iOS and Android, and then your tablet analogs to your iPads or your Android tablets. And that gives them that mobility that they need and that they crave, and that the legacy software vendor in the US can't really deliver on because they're so focused on meeting Medicare requirements. So the ability to be mobile for the providers is huge. This is a provider-first software. We want to give them the ability to create and move data from the point of care, which is vastly different to what you've seen in healthcare software for the last 30 years. But then on the flip side of that, you have all this auxiliary staff, all the support staff. Maybe it's your billing office, or it could even be somebody in patient accounts. Rather than send them into a different type of workflow and have them use their phone to use our mobile app, we actually have a browser-based portal for them as well to pull down whatever information that they need related to the patient encounter, whether that's billing or whether that's more clinical, and route it wherever it needs to go automatically.
Yeah, sounds good. And I guess from a feature point of view, you guys, it's also going to be very, very user-centric, right? I'd imagine there's a lot of user research that goes into this.
Big time. And in fact, that's one of the, it's a core piece of DocBuddy DNA that in one of our products that's more geared towards the ambulatory surgery center, so same-day surgery center or outpatient surgery center, depending on the specialty, there's different requirements for the amount of images needed to accompany an operative report.
Yeah.
This is really cool. I'll toot our own horn a little bit here that we had a particular surgeon in a particular specialty say, hey, I really need the image limit on a per operative report basis to be X. And X was a very large number, much larger number than that I would have guessed. I don't have a clinical background, though. I'm a lowly marketing and biz dev guy. But that was put into our very next sprint and made available to him the following week. So
wow.
To react very quickly on customer feedback, we believe very strongly in voice of the customer. To a point, for those that have ever been in hospitality, the customer is not always right. They're not always wrong either, but that doesn't mean that they get what they want automatically.
Yeah, interesting. Very quick turnaround as well. So DocBuddy then, you were founded in 2014. Look, it's longer than some of the companies that come on this show. You must have seen some changes in the healthcare technology space over that time. There's a little bit of an insight into that. Any challenges that DocBuddy's had to overcome on that sort of decade journey as well?
Sure. So yeah, we were founded in 2014, and I just spoke to our surgery center solution, or one of our surgery center based solutions. We got our start though back in 2014 with our clinic based solution called Enterprise. And as much as things have changed, the more they've stayed the same. And this is, maybe I have a future in politics answering questions this way. But going back to 2014, we saw this huge demand that providers need more mobility. They don't want to be chained to their desk. They don't want to have to chart after hours and spend literally their nights and weekends finishing patient charts. And your listeners will know there's sort of a two-pronged effect there, that both for patient safety and to do your job as a doctor, you need to have complete records. But there's a second order consequence here too, that until you have a completed chart that's been signed on a per encounter basis, you're not able to bill for that encounter. You can't submit that claim to insurance for reimbursement. So it's not that you just want to do a good job and be a physician and have a clean stack to go into on Monday morning where everything's been signed off. You're not getting paid until these things are signed off.
Wow.
So to go back to 2014, we're seeing that providers are spending 2/3 of their time on this paperwork. Well, like we said, things are not getting better there. Now, obviously, users of DocBuddy have a different experience, but when you look at the broader market, physicians are still spending more time than ever in legacy health IT products. So we're shouting it from the rooftops that with DocBuddy, you get more time for life because we're removing that pain and cost of these legacy workflows. So it's a sad state of affairs. And it isn't that the legacy EHR vendor, which is electronic health record vendor, it's not that they don't care, that they don't know this, but their development resources have to be spent on meeting Medicare requirements, meeting private carrier requirements for data capture and quality reporting. So it's a very interesting animal that there's so many market forces and so many dynamics that we know physicians feel this way. But it's taking an organization like DocBuddy to really solve for X on how do we keep these guys and these gals happier in their roles. So they're not retiring ahead of time and then leaving the American healthcare consumer in a lurch to be able to even access care.
I find that there's a lot of doctors that are actually leaving the industry because of this problem.
They are. When you look at the more and there's plenty of surveys out there, but when you look at the Sterling Silver class, just the best of the best, the most reputable surveys at the largest scale, it boils down to a lack of autonomy in their day for the
Yeah.
provider. It boils down to I'm using too much of my time in my software or technology, which is meant to help me but isn't.
Yeah.
And going down the list, it's all related to the use of legacy tech and lack of control over their day. The providers are retiring early, and even more scary in the US, Lee, keeping residents out of medical school, keeping people interested in the profession away.
Such a big problem, and we're talking about the US in the show, but it's not limited to that. I talked about here in the UK. Of course, we have an NHS here, but we have nurses on strike, we have junior doctors on strike, we have midwives on strike, all at the same time, and all because of the same problem. And it's the same thing. We're being burned out. We signed up to help people, care for our patients, and we're not able to do it because the bulk of our day job is actually filling in forms, admin, literally writing. And sometimes not even on a on a PC or a laptop.
Right.
Crazy. So what danger of this getting worse? How do we? I don't know. As a worldwide healthcare situation, how do we tackle this before it gets completely out of control?
Well, I can speak more intimately to the U.S. healthcare system. I want you to chime in on how you see the NHS treat itself as a system, and then anything happening in the EU or even further abroad. But when you look at healthcare in the U.S., until the last 13 or 14 years when we got meaningful use, which was a law that was a part of a 2009 bill that George W. Bush started, and then Obama signed into law, which was the ARRA 2009. Until you hit that threshold, your mechanic could tell you more about preventative maintenance for your car than your doctor could. Hey, you're about ready for an oil change. Come on back in. But if you have a chronic condition prior to using an EHR, your physician would have no way to know unless they had a very elaborate post-it note scheme on a Kanban board. And, we haven't seen Lee for 6 months, but he's due. There was no way to know. How do you recall a patient? We need software to do it. And software was obviously eating the world. We live in a software-based society now, with the exception of healthcare, where all the efficiencies that industry gains from technology, healthcare doesn't seem to have realized those same gains. Why? I'm not sure I'm the person to answer that, other than a sort of cynical view that we're, making our providers become data capture specialists as opposed to doctors. So that's how I see it from my point of view, at least stateside.
And it's similar. I mean, it's a crazy one because here in the UK, of course, we have this big old NHS, but there's so many different constituent parts to the NHS, and even those constituent parts don't speak to each other. It's mind-blowingly crazy, and I was speaking to a company over in the US in New York actually recently. They're trying to solve the problem of data not being shared within companies within the US healthcare system. Patients not being able to access their own patient record. And for me in the UK, although the NHS is disjointed and it's cumbersome and there's lots of problems within that, at least you can get hold of your actual patient records. At least if I have an allergy to penicillin, that my doctor and the next doctor and the next doctor might be able to see it. So there's lots of things that are going on, but it's certainly an interesting one in the US for sure. I guess. Does Doc Buddy have any plans to go overseas?
There's likely going to be some big news shared in the not too distant future. Obviously, we have a neighbor to the north here that's not quite overseas, but yes, the more we learn about the difficulties providers face across the globe, the more similar they are than different to what the new care provider experiences. Not enough time, lack of interoperability. You think with how many times in my life I've said interoperability, I could just spit it out. But then just the inability to create, move, and access data at the point of care, that should be a no-brainer.
Yeah.
But it isn't.
I have plenty of family and friends that are in the healthcare space in this country that would, I'm sure, be interested in a product like DocBuddy. So Eric, thank you so much for joining us. That's all we've got time for. Guys, this has been Eric Sunset from DocBuddy. Eric, thanks again.
My pleasure. Thanks for having me, Lee.